Hi guys, this is just a short PowerPoint for you. I'm Jenny Mee and I'm one of the tutors in your subject. I just thought I'd run this little PowerPoint just to it's just some information for you about how to assess the gender health of your clients in terms of our obligations under our Nursing and Midwifery Board competencies, as well as the Code of Ethics that govern us, and just a few tips of the trade and some of the things that I would do as a nurse when I'm actually working out in the field. But just so in terms of getting you started for safe and legal and ethical practice, I just really want you to consider the concept of power in terms of how you assess your clients, and have an understanding that us in our uniforms, we're in a great position of power over our clients, and particularly when it comes to dealing with very, very private matters, we're holding on to information and we have power over the knowledge and we have power over the information of our clients. So as you consider how you might approach clients in terms of assessing their sexual health needs, I really want you to consider, first of all and foremost, the cultural and contextual considerations of the client. If you don't know the culture of the client, ask. If it's documented, it might be documented in their front admission sheet of their chart. The other thing that you can do is also, if you don't understand the cultural background of that group of people, then perhaps you can talk to the cultural liaison officer to your hospital, or your culturally and linguistically diverse officer, or maybe you might have a client who identifies as Indigenous or from the Aboriginal and Torres Strait Islander group of people, and you're not sure about their preferences for what they believe. You could talk to the Indigenous liaison person as well at your facility that you work at. I think it's really important though that as soon as you've identified the fact that you've got an Indigenous person that you're working with, that you pay your respects to them and that you thank them for allowing you to look after them, and that you'd like to really know a little bit more about their culture. But in doing that, from my experiences, I know that when I've looked after Indigenous people, that you can't really just ask very, very private questions about men's business and women's business straight away. I think it's really important that you establish rapport. You tell them a little bit about yourself, but you also ask people if they prefer to have a man or a woman looking after them, or asking them questions about their female sexual health or their male sexual health, and establish that trust right in the outset of the interview. There's really, really strong values, particularly in our Indigenous culture, around women's business and men's business, and most of the time a lot of Indigenous women would prefer to have a woman look after them, and men again have men looking after them. But sometimes there's times when that doesn't happen in hospitals because of limited staffing or whatever, so you've got to really consider that the hospital is a really busy place, and sometimes it's hard to get staff, but we have to do our utmost to try and accommodate that with our clients if we can. So before you actually start interviewing your client, I think it's really, really important that you set up and you do this sort of interview in a private place, not with other, patients, visitors right next door to you. If you can try and find a private examination room, that's the best. But it's the other thing that's really important is to get a do not disturb sign on the door. Make sure you prepare the environment and the equipment first. Don't put someone on a cold plastic mattress on the trolley. Make sure there's a sheet on it. Make sure you've got some extra sheets to cover up the client. Make sure you've got an appropriate gown, that you've got curtains, or even some bulldog clips that you can use to shut the curtains with. Will offer some more privacy to your client when you need to interview them, and also perhaps perform a sexual health assessment. The other thing that I do as a nurse, particularly when I've worked in the emergency department where it's really busy, doctors are in and out behind the curtains, and so are other health professionals, and the secretary comes in with the chart and things like that. It's not an ideal spot to examine a patient. So some of the things that you can do to make the patient feel more reassured is to position the trolley so that their feet are facing towards the wall and that their head's towards the opening of the curtains, so that if someone does walk in while you're examining them, that they're not exposed all of a sudden, that their genitals are actually facing away from the opening of the curtain and towards the wall. So as you go about establishing your rapport and your trust with your client, you just really need to ask them if they've got any special requests in regards to the gender. I think it's really, really important at this time that you would reassure the client and say, you know, if you like, I can get you a chaperone to come into the room with me. If you prefer that there's two people here at the same time, or would you like to have a family member present, or your spouse or your partner present while I'm talking to you about these questions. You can also, you know, use a little bit of personal sharing to say to them, you know, I feel uncomfortable too when I've got to have this sort of conversation with the doctor. You can talk to them a little bit about, you know, the fact that you're a professional and that you're, you know, that you will maintain their confidentiality and that you'll only disclose things into their chart that are necessary for their medical and nursing care. And it's also important that you ask them, you know, about anything that they might have disclosed to you in the past conversations that you've had. So if they've given you some subjective data about some problems that they've had, or a rash or something like that, that you start the conversation with that. It's a really good way to start the rapport and the trust, and say, can you and use open-ended questioning, and then probe after you've asked the open-ended question. So use a lot of things, you know, questions like, can you tell me a little bit more about that rash that you told me that you had below? And while you're saying that, you're not examining the patient yet, you're just having that conversation with them first. And you can say to them, look, I'd like to just have this conversation with you first, find out as much information as possible before I need to have a look at anything. And so the other thing to consider when you're establishing rapport and seeking consent is also just say to the client, you know, there will come a time that I need to look underneath your clothes. Is that okay with you? And do you want me to have a chaperone present, or would you like your spouse to be in the room, or your partner, or your mum or your dad if it's a young person? And it's at this time that you need to consider and reflect on what the client says. So if the client is, you know, is responding to you in a way that's a little bit hesitant, or you can see in their body language that they're feeling quite uncomfortable, you might need to ask them questions about why they feel uncomfortable about being examined, and say, look, I can appreciate this is really awkward type of thing, and you know, a lot of people feel quite embarrassed about health professionals having a look at your private parts. Is there something I can do to make you feel more comfortable? And I think it's really just going with your cues that you're getting from your client and looking at their body language and looking at some of the facial expressions, and you know, have they got their arms crossed? Or are they using a defensive position, or are they comfortable? Are they starting to shake, or are they looking away from you? Are they able to maintain eye contact? Often if a person's very, very embarrassed, they won't maintain eye contact with you. But saying that, Indigenous people will often not maintain eye contact with you, because that's a part of their culture and a form of respect, that they don't look you straight in the eye. So the other thing that you need to make sure that you've done is that, as I talked about, is that you get the consent of parents for examining any client under the age of 18. However, later on in this booklet, we're going to talk to you a little bit about age of consent, and a little bit about where teenagers might be able to give consent because they're old enough to understand what's going on, and sometimes teenagers can seek medical advice on how to approach this. There's a really good video and video vignette later on in the adolescent chapter of this booklet that you're working through today. So we talked a little bit about power and about, you know, your positions of power and working with the client. I think, you know, as I discussed before, one of the really important things to do is that when you're positioning your client in the room for their examination, what you need to do is to make sure that you position yourself also lower than the client. So make sure that the bed's lifted quite high, and that you've got a chair that you're sitting on and that you're facing the client, but slightly to the side, so that you're not lording over top of the client. You want to position your client just slightly to the side, and they might be sitting in the bed like this, so that they feel like you're, you know, not dominating over them as you're interviewing them. So some of the questions I ask my client, just to get them talking, I'll talk a little bit about their sexual development and their maturation, and I might say to a woman perhaps, well, how old were you when you first got your periods? And tell me a little bit about your menstrual history and any problems that you might have had, or perhaps young boys, you might say, oh, when did you first notice you got pubic hair down below, and or when did you first start maturing? And then you can ask about people's sexual activities and any problems in a very open and non-judgmental way. And so this is where I ask about people, and I say, are you sexually active? Can you tell me a little bit about the sexual activity that you engage in? And it's really important here as a nurse that we're very non-judgmental of people, because some people might have had multiple partners, or they might have not had any partners at all. And it's very important to also understand that some people might have a different choice of partner, and some people might be in homosexual relationships, and some people might be in monogamous relationships. Some people might have bisexual tendencies, or people might also have relationships where they have multiple partners all at the same time. As a nurse, we hear all sorts of types of information when people are giving their sexual health history. It's very important to be very neutral about the way we hear that information. But it's important at this time that as you develop your skills in sexual health assessment, we also ask about people's contraception that they use, or perhaps the barriers that they might use to protect themselves against sexually transmitted infection, or STIs. And it's here that we also ask how compliant they are to actually using protection. And then as the client starts to tell you more and more about their sexual history and about their lifestyle and about their partners, you can also, go with the cues that they're giving to you and explore their body, look at their body language and how they're talking to you, and then again design your questions to suit the age of the client, their maturation, but also what they're telling you. So it's very important that you design your questions around what they're telling you. But sometimes there's a time as a nurse when we need to probe and also ask questions about what they're not telling us. And so as you develop your skills in interviewing, this is where you'll certainly find out how to probe clients and ask them more questions as you, and people will start to tell you more as you develop trust and rapport with people. So for younger people, when you're interviewing them, it's really, really important that you gauge how comfortable they are answering their questions, particularly if their parents are in the room. So you might say to the young person, look, do you want your mum and dad in the room while I ask you these types of questions? Are you okay with that? And teenagers might not want their parents in the room. And here the nurse needs to establish a rapport with the parents, and also and ask the parents and say, hey, your son, daughter doesn't want you in the room while I'm asking these questions. Are you okay with that? But there's times as well where a teenager might seek advice about sexual health, and particularly in the video about Taylor in the adolescent section of this module, it's a very, very excellent example about how to assess a teenage client who's below the age of consent, but and there's some discussion around what the laws are around that. So, but when the parents want to stay in the room, this has to be dealt with very sensitively and contextually as to what's going on in those family dynamics. So what I want you to do is, when you were a teenager, I want you to really reflect about, what was it like for you? Did you want your parents to know about your first sexual encounters or any sexual activity that you engaged with? How did you feel about it? And so sometimes we have to consider those feelings as we're interviewing our clients, and share how we might have felt as well. Say to the young teenager, I would have felt really awkward with my mum and dad listening in on stuff like this. It's up to you. If you want your mum around, that's fine. If you don't, then maybe there's another time you want to come back and see us. But often I think a teenager will try and come and see you about those sorts of things without their parents around. So, but it's really important that as you ask any questions about a person's sexual health history, that you reflect on your own professional boundaries as a professional, as a nurse, and that you only ask questions that are relevant for the care of the client. So you don't ask people ins and outs about, what they do during sex, and what positions they get into and all that sort of stuff. That's not appropriate. So I've already spoken about seeking consent and suggesting a chaperone, but this is what's really important while you're actually examining the client is that, you know, you tell the client first before you're going to examine them. Look, I need you to hop up on the bed, I need you to lie flat on your back, and if it's a woman, you need to, you know, lie with your legs open so that I can have a look. You know, here's the towel, you can cover yourself up so it's private. I've got this little lamp up overhead on the trolley that we're going to have a look at to make sure that you don't have any lumps or bumps or moles or discoloration of your skin down there. And so it's really important that as a nurse that you understand that for females that you do not examine the internal genitalia of women unless you've undertaken highly specialised training. And so as a beginning practicing student nurse, you'll only examine the external skin and the hair and the shape of the genitalia and around the perineum and the anus. And in second degree of your course, you'll learn how to actually insert catheters, and we'll teach you more about examining internally and looking at the structures of the anatomy internally in terms of the urethra. However, in your recommended readings of the textbook, there is some quite graphic reading about how to undertake a pelvic examination. I must say to you that nurses don't routinely undertake pelvic examinations of clients unless they've undertaken a sexual health nurse training program and they've been accredited to do so. But really normally a doctor does the internal examinations. Or perhaps a midwife might do that, but generally registered nurses assist doctors in doing these internal examinations, and we might act as the chaperone in the room. So how do you document what you found? The important thing is that you document what you find safely, securely and accurately, and it's important that when you're writing in someone's chart that you do so in a private space. And generally we write in a person's notes, in their progress notes, and we document by exception. So we would only document abnormal findings or any problems that the client has discussed or disclosed with us. And normally in most hospitals recommend the format of using the acronym SOAPI to document. So we would present the subjective data, assessment data that the client presented with. We would then document our objective data of the findings, so what we visually see, what we visually palpated, and anything else that we've just determined while we were assessing the client's genitalia. We would use an assessment, what was our assessment, and if there's any problems, what have we done about it, and what's the plan, and what happened, and what was the outcome of those interventions for the client. So for example, if you had a client who presented with you and they explained of some excoriation down below because their incontinence pad was rubbing, perhaps an elderly client, then we would say that the person complained about having some excoriation. On assessment, it was noted that there was redness in the perineal area as well as extending up past the mons pubis, and there was some excoriated areas in the inner thighs, and you would document your findings there. And then upon assessment, the patient's got a low-grade temperature, the skin's warm to touch, and there's some blistering, and it appears like there's some skin that's sloughing away on, in the groin area. And so the plan is that I'll discuss the findings with the doctor and recommend that the doctor review the client and prescribe some antifungal ointment if needed. And so as a nurse, then I would have implemented that treatment plan and then evaluate the client in a day or two time, in a day's or 1 or 2 days time, to make sure that the excoriation's been fixed up. So when there's problems, there also needs to be given a diagnosis, and so in this case, the diagnosis for this particular client could be perineal excoriated area related to incontinence, or you could talk about altered skin integrity in the perineal area related to incontinence, and so that could be your nursing diagnosis. So I know that you haven't undertaken law yet, and that's part of your second year program, but some of the legal issues that you need to be aware of, some of the laws that you could maybe think about maybe doing some research on if you want to extend your law knowledge at this stage, is to understand issues of consent, battery and tort law. And so as a nurse, what that means is that if we examine a patient, we don't have consent, we can be charged with assault. and we could be charged with battery under both civil and criminal law, and clients have got a right to pursue damages from us if we've harmed them, or we've treated them without consent, and so can parents. So we have to be very, very careful that we understand law very carefully. We have to practice within our scope of practice, and we also can be negligent if we don't do anything about what we find. And we have a duty of care to our clients to treat them even with their sexual health issues, even if we feel uncomfortable with it. And we're bound by our APRA registration and Nursing Midwifery Board competencies, and so as and the other thing that we need to be professionally aware of is our professional boundaries in terms of not assaulting the client sexually in terms of when we're undertaking a sexual health assessment. So that's all I really wanted to talk to you about today. There's a lot more to go through in terms of the booklet now, but I just really wanted to give you a little bit of an inside view into how to start off your relationship with your client when you're undertaking a sexual health assessment. Thanks for listening.